coronavirus pandemic. I must tell you today, we should never create this as coronavirus panic pandemic or fear pandemic or anxiety pandemic. I really want to compliment our Prime Minister, Shri Narendra Modi, who has been very instrumental and very quick in taking a timely action of closing the airports, closing the visas, and started quarantine very well in time. And that's how the prevalence in India is low and the mortality is least. I'm also very grateful and compliment our health minister, who is very vigilant and working really hard. I've seen the people are very anxious. The people are very much concerned. They are in fear psychosis without knowing the details. And a lot of fake news are there. A lot of floating rumors are there. We're changing our mindset and making us more anxious. So I don't think we should create any kind of panic. It will create more problems for us. I must tell you today that this virus is not a deadly virus. It is a flu virus. The only problem with this virus is it is highly infectious, contagious, and the infectivity rate is 10 times more than a usual flu virus. That is only the matter of concern. If you see the mortality is only 2.5 to 3%. That too in elderly patients beyond 60 or 70. And it is only in those patients who have underlying comorbidity like hypertension or coronary artery disease or diabetes or cancer, or they are immunologically compromised. So I don't think everybody is vulnerable. 80% to 85% of patients have very mild infection. They recover. They just need quarantine. They need isolation. They need rest at home. I just saw some data emerging out from China, from Wuhan. Since this virus affected the respiratory system, it limited to respiratory system. There was some element of fibrosis in the lung. Heart was absolutely normal. There was no evidence of myocarditis or any infection. So in short, if I see the mode of spread of this virus infection after having incubation period of 2 to 3 weeks, it affects the respiratory tract. It affects the nose, throat, airway and lungs. Important precaution of hand washing is we must have frequent hand washing, at least 8 to 10 times a day. And when you wash your hands, we must make sure that we use adequate soap and water and use it at least for about 20 to 40 seconds, cleansing the front portion, the back portion and the spaces in between the fingers, so that there is a complete cleansing. We should not leave any remnant there. Hand washing is the need of the hour for everyone. Then the government of India has taken a very strict action. The schools are closed, colleges are closed, offices, major offices are having more of a virtual meetings or meeting on mobile phones. So that should be done, which is a very, very important isolation. Thank you very much.